Hello, welcome to my channel, My Student Support System. In today's class, we will discuss very important topic CPR or BLS. This lecture is in English and if you want to study in Hindi, just click on I button or you can visit my channel. CPR, BLS or basic life support is a system or process which should be learned by everybody, be it a medical person or non-medical. So what is basic life support? It is a level of medical care which is used for the victims of life-threatening illnesses or injuries until they can be given full medical care at a hospital. It can be provided by trained medical personnel including emergency medical technician, paramedics and by a first aider. Indications for BLS: when we can provide or we should provide BLS in dead cases. Dead cases means there is no pulse, no breathing, but it should be before 10 minutes. Drug overdose, cases of drug overdose where heart stops breathing or lungs stops working. Drowning cases, poisoning, shocks. We should keep in our mind that in these cases the response time should be very less or quick response time should be there. Act fast because first 10 minutes are crucial. Earlier is better. As early we will start, we will get more positive outcomes because there are chances of brain death after heart stops. If we are reviving the heart within 4 minutes, then there will be low chance of brain death. Between 4 to 6 minutes there will be low chance, and between up to 4 minutes there will be very low chance. Full recovery can be attained up to 4 minutes, but later there will are some damage to the brain, and 6 to 10 minutes there are high chances of brain death, and after 10 minutes you can't do anything. So what should be done? First of all, when we reach the site, we should assess the collapsed victim. And before assessing, we should make sure that scene should be safe, site should be safe for all. Make sure that environment is safe for rescuer as well as for victim. So how we will assess? We will shake and ask, are you okay? Are you okay? If there is no response, then check carotid pulse and respiration simultaneously. Carotid pulse is here, we check pulse is there, and simultaneously we check for respiration to reduce time for first chest compression. If again there is no response, then we start CAB. Nowadays we are not going for ABC, we should go for CAB. What is CAB? Circulation or cardiac compression. This should be started first because our main motto is to provide oxygen to the brain as early as possible. Airway opening, second, and third, B means breathing. It may be mouth to mouth respiration. So how you will check that there is circulation or not? Signs of circulation: checking the pulse. In adult we check carotid pulse here, and in infants or newborn we check brachial pulse here. After checking pulse, if no pulse, no respiration, then we start life-saving measurement, that is BLS. We call for medical aid, dial 112. This is universal number in India. We will dial, or we ask a bystander that call 112 and explain the situation so that response time is reduced. Then we will proceed to next step, that is new update for BLS, that as per new guideline, alerting medical response team is flexible depending upon the situation. We should keep in mind two situations. What are those? If collapsed in front of us, then we will call first because we have time. Just we have seen collapsing the client, we will call first. And if it is not collapsed in front of us, then do not call first. First we will start chest compression for 2 minutes and then we will call. This is new update you should keep in your mind. Why this is? Because our main motto is to start oxygen or to provide oxygen to the brain as early as possible. Now, how we will provide oxygen? Just we go for cardiac compression. If we are single rescuer, then initiate chest compression before giving rescue breaths. Previously, we used to start two rescue breath, but no. Nowadays, we start CAB rather than ABC. So we go for chest compression, forget about two rescue breaths before starting CPR. Start chest compression. And as you know how we start by compressing the sternum. While providing CPR, make sure that client should be on hard surface. Okay, and it should be flat. Keep in your mind that when we provide CPR, we should be at the level of client. When patient is in the bed, you should lower the bed so that your elbows are straight like this. And if it is not possible, then you should climb on the bed and sit on your knees. What should be the position of your hands during CPR? Your position should be like this. You can place your heel of right hand palm on sternum between the nipples and then left hand on above it, and the fingers of left hand are locked in this way and place on the right. You can see here the exact position. Now we start CPR and we should keep in our mind that elbow should be locked like this. We should not do CPR like this. We should do like this. The force should come from the shoulders. This is upstroke, then it is going, this is downstroke, and elbow should be straight. Okay, means we should use the power of our body weight and shoulders, not the elbows. During CPR, we should push hard. Okay, and the chest or sternum should go at least 5 to 6 centimeter down, and we should push fast. We should push 100 to 120 times a minute. So the base is push hard, push fast. For children, we use one hand. The same system will be there, only one hand. So base of one hand will be used like this for children, and for infants we use two finger or we encircle the chest, and in this way we use our thumbs. Okay, for fingers and thumbs. Then after providing this cardiac compression for 2 minutes, then we come for A. Because in these 2 minutes we have circulated the blood up to brain and some oxygen has reached to the brain. Now we go for checking the airway. Okay, we check the airway by the head tilt and chin lift method. As you see, we tilt the head back and lift the chin so that the tongue which is fallen can be restored back and airway is cleared. Okay, we should keep in mind that it should be less extended in children and infants. We can, if we find anything in the mouth, we can clear the airway by using fingers or handkerchief. Now we come to B. Check for breathing. How we check for? We will check for breathing. Just we check that the chest is rising and falling or not, and we can also check if air is coming or going from the nose by keeping our cheek near to the nose of the patient. Now, after checking these, if there is no respiration, no pulse, then we start CPR in the ratio of 30:2. 30 compression, 2 respiration. 30 compression, 2 respiration. We should keep in our mind that while giving respiration, we use two methods. One is mouth to mouth respiration or mouth to mask to mouth respiration. While giving mouth to mouth respiration, maintain extended position of neck like this. Hold the chin by left hand and right hand on the forehead, and then pinch the nose with this right hand. Inhale full deep and then blow into the client's mouth. 2 full respiration should be given, and you should seal so that all air which you have inspired should go into the patient's chest. And while blowing, you should see that chest is rising or not. If there is no chest rise, then we will reposition the neck and again we will do second breathe, and then we start again chest compression in the ratio of 30:2. Prefer mask to mouth respiration so that infection can be prevented. If mask is available, then it is better. If by providing this patient starts breathing, it is very good. We are happy. Then provide recovery position to the client and wait for ambulance to come. Recovery position like this. And once you begin CPR, when you should stop? You should not stop except in this situation. If you see the obvious sign of life such as breathing, you can stop. If AED is available and ready for use, you can stop. Another trained responder or personnel take over from you, you can stop. You are too exhausted that you are not able, you just fallen and the scene become unsafe. Only then you should stop CPR or the ambulance has come. If ambulance is there, then transport the client to the hospital. In this way, we can save life. Dear students, you can visit my channel for more such videos. Channel is, My Student Support System. Just search in the YouTube. You can join my group on Facebook, that is Nursing Notes. You can follow blog for making your notes, My Student Support System, My Student Nursing Students blogspot.com, and Twitter @student_support. Thank you. Have a nice day.